A 2024 study had revealed that drug abuse and drug use amongst adult South Africans have doubled since between 2002 and 2017, with South African women in particular taking to drug use and illicit drug abuse more rapidly. We now speak to Dr. Nazil Daniels, psychiatrist who is a member of the South African Society of Psychiatrists, who joins us now. Dr. Daniels, good evening. Thank you so much for your time. Do we have any data that will help us make sense of why it is South African women of reproductive age that are most prone to taking up illicit drug use?
Oliver, thank you for having me. The reason we are wanting to have this conversation is that today is International Women's Day. And as you quite rightly said, we've seen an increase in substance use across the board in South Africa. But in women in particular, the highest prevalence is among women of reproductive age. And what we really want to look at is the fact that these women are also the women who are falling pregnant, and to look at the issues surrounding substance use in women in pregnancy. And substance use is a complex issue. There are many contributing factors, many social factors that result in people using substances. And for women in particular, in South Africa, we struggle with many social issues such as poverty, low levels of education, unemployment. Many women are heading up single-family households in which they carry a lot of responsibilities and stressors. We know that we have problems with gender-based violence. And all of these things contribute towards the higher rates of substance use. Often people use substances or turn to substances when they're trying to feel good amongst bad circumstances. Also, people often use substances as a way of self-medicating when they suffer from mental illness. And as psychiatrists, we're particularly interested in looking at that. And substance use disorder is a brain disease. It's a disorder. And our concern in pregnancy is that women are stigmatized and somehow painted as bad mothers, whereas we know that most women are really prioritizing their babies in pregnancy and want to do best by their babies. But because this is an issue where there's so much stigma, women carry a lot of shame, and this might be a barrier to them accessing help and getting the support and care that they need, and rather sort of being in the shadows, feeling ashamed, and continuing with the substance use, which has major consequences both for the pregnancy and for the unborn baby.
How much of it do we know to be internal factors versus external factors? That is to say, how much of it do we know to be a situation in cases of undiagnosed mental health disorders, such as ADHD, for instance, which amongst adult South Africans is severely undiagnosed. We have adults with dysfunctional frontal cortexes that can't produce dopamine, and so they resort to low levels of dopamine production, and drugs seem to be incredibly useful for those purposes versus, say, external factors such as poverty, gender-based violence, and social inequality?
Yeah, it's a difficult question. I don't think we have those numbers necessarily because it is so multifactorial. It's this sort of intersectionality, you know, all of these different factors contribute. So it's really difficult to know to what extent one is contributing more than another. And as you quite rightly say, because mental illness itself is actually quite rife and we have high levels of undiagnosed mental illness in our population, it's difficult then to factor in, you know, how many people represent that section of the numbers versus all of these other factors.
Yeah. What is then an easy solution to this? Because the proliferation of drugs and access to drugs is significantly higher today than it was, say, in 2002, where the study had focused on. What are some of the low-level interventions that we can do to help turn around the picture?
Yes, it's difficult. I think there isn't a simple solution because it is such a complex problem. You know, I think the first thing is we want to try and, as I say, reduce the stigma so that people feel they can access care. And, you know, there is stigma even amongst health professionals. We need to be educating all of our health professionals who work in maternity services so that they are not judging these women when they come and access care and help, that they're saying this is actually an illness, these are the risks, how can we help you? And even within our communities, you know, we may see people struggling with these problems. And I think it's important in a non-judgmental way to be able to try and have conversations with them and really, on a very, very basic level, be saying to people, how can I help you? How can I support you? And I think attitudes have changed. You know, we see women coming to us as psychiatrists, they're pregnant, they're using substances. they might be accompanied by their mother who's saying, well, I had these same issues in my pregnancy. So we have these intergenerational patterns. And really what we want to say is we can do something differently here. We can change attitudes and we can try and offer solutions. There's not a simple solution, but certainly that's a good starting point.
Does this problem affect women disproportionately based on class and other demographic indices?
So it's a difficult one. We know that that many class-related or social issues are contributing factors, and so those women will be more vulnerable or more at risk. But, even amongst higher socioeconomic groups, there are many substances that are almost socially sanctioned or socially accepted. And there's a lot of misinformation out there, I think. So even women who are educated may continue using alcohol or substances during their pregnancies. And I think they too could benefit from education and this kind of information.
Yeah. Dr. Nazil Daniels, thank you so much for your time and your insights. I really do appreciate it. Dr. Nazil Daniels is a psychiatrist and a member of the South African Society of Psychiatrists.